Our line will be ready to start. Hello and welcome. Give everybody just a moment to get on here and we'll kick off. Welcome officially. Thank you all so much for joining us for today's webinar. My name is Julie Matusik, and I will be moderating today's webinar. We're excited that you're here today. If you are joining us through your computer, you have access to the webinar through your computer speakers. If you are joining via phone that Zoom provided, your line has been muted to minimize background noise. And for those of you that are online, please note that there will be in just a moment a link to a Dropbox folder that has all of the handouts that we'll be referencing throughout the webinar today. Here you'll see the handouts. You can download those at any time. And also want to mention that you can put any questions that you may have right into the Q&A section of the Zoom panel. So feel free to enter comments and say hello to each other right in the chat. Can use that for discussion, but any questions that you want to be sure that we don't miss, please enter those right into the Q&A section of the Zoom panel. If you are having any technical issues, we have live tech support here to help you. And you'll, if you need to reach them in the chat, you'll use the drop-down box and click NFSN Webinar Tech. So you can use that at any time. And with the questions that you enter into the Q&A, I will get to all of the questions at the end of the webinar. We'll make sure we have time to answer as many as we can at the end of the webinar. And if we are unable to get to them, someone from the NFSN will follow up with you after the webinar. And also want to mention today's PowerPoint, as well as all of the handouts and a recording of this webinar will be available on the NFSN website on the Webinar Wednesday page by this time tomorrow. So you'll be able to share it with anyone that couldn't access it today or couldn't join us live. When you exit the webinar, last thing that I'll mention is that an evaluation will automatically appear on your screen. So we ask that you take a moment to complete this as it provides us with valuable feedback to inform future webinars. Okay, so really excited to get an idea of who is here on this webinar with us today. So take a peek at this map that you see on the screen, and you'll see that we have divided the United States and its territories into regions. So take a peek and see which region that you are in, and we're going to launch a poll so you can let us know which region you are joining us from. And you'll see that in addition to the US and its territories, there's also Canada is an option and other international. So let us know where you're joining us from. All right, take just another couple of seconds here if you haven't had a chance to respond just yet. And we'd love to hear where you're joining us from. All right. Looks like the South is coming in strong here with right around half of our participants today, but great geographic diversity overall. We also have representation from the Northeast, the Midwest, and West. So wonderful. All right, thanks so much. Our next question that we have for you is about your affiliation. So we'll ask everyone to respond to the poll here when it pops up for you. So what is your affiliation? Maybe you're joining us from a family resource center or from a family resource center network or another family support program. Maybe you're a parent leader or in early care and education, or maybe you're in government. We have a couple different categories there, or a private funder. All right, take one more moment to respond if you haven't just yet. All right, let's see those results. Okay, great diversity here as well. So we have family resource centers, family resource center networks, other family support programs, government, particularly in child welfare, and then others as well, private funders. Great. And if you picked one of the other, if you clicked other, feel free to put in the chat what your affiliation is if you'd like to. Wonderful. Thank you so much. All right, last question. And this relates to your level. Um, so what level you work at? Do you have the privilege of working at the policy systems level, or are you in management? Or maybe you're have the opportunity to work directly with families and direct service at the program level. And again, if you put other, feel free to put that in the chat. Okay, take just one more moment here. Okay, it looks like we have wonderful diversity here. So all of these areas are represented with a tie coming in for the policy systems and management level, but definitely have program and direct service staff here as well. So that is wonderful. Thank you all so much for responding. And with that, let's go ahead and dive in. I'm going to share a bit of contextual information first about the national network. So the national network, the National Family Support Network, we were founded in 2011 by 8 states originally. And since then, we have more than quadrupled in size. And we now have 40 member networks across the country. So 39 states and the District of Columbia that represent more than 3,000 family resource centers that are serving more than 2 million people annually. And so really exciting to see this map changing regularly. Our mission at the National Family Support Network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And our vision, in short, is that that whole map that you just saw, that whole map would be turned green, ensuring that all families across the country have access to quality family support services in their own communities, provided by family resource centers that are supported by strong networks in their state. Okay, so here's our roadmap of our time together today. I have a couple more introductory things to share with you, and then very excited to introduce to you the folks that are here with us from the Family Resource Center Network in Texas. And then we'll share some resources and opportunities that are available to you through the National Family Support Network, and we'll close with an evaluation. Okay, so a little bit more context, just to make sure we're all on the same page here. First, we'll introduce family resource centers. So thousands of family resource centers have emerged organically across the country, yet their existence is still largely, although increasingly less, under the radar than it originally was. So we call that America's best kept secret. And a family resource center is a community or a school-based welcoming hub of support, services, and opportunities designed to support families to be strong and to be successful. So these family resource centers, they may be community-based, like the image that you see here on the left, which is of a family resource center in Vermont, or they may be school-based, like the image that you see here on the right from Kentucky. And so family resource center networks, so looking one level up, so we talked about family resource centers, and then how are those family resource centers networked together? So these are family resource center networks, so how those FRCs are connected. So not only have cities and counties and states hit upon the value of family resource centers, but they have also hit upon the value of networking them together. And here you can see the most common functions of Family Resource Center networks. They are to increase the connectedness, coordination, and cooperation and collaboration amongst their members, and to provide training and technical assistance, and also to work on advocacy, policy, and legislation. And another one is to provide and maintain a shared data tracking system. And this data comes to us from a national study that was completed with a research institute in Colorado. And another way we talk about family resource centers networks are we have these different types that you see here, and we'll talk about the stages in just a moment. So the type of network speaks to how they're coordinated. So the first we'll talk about is volunteer coordinated. These are led by FRC directors themselves in a voluntary leadership capacity without paid network staff. So New Hampshire, West Virginia are examples of this. And then we have funder coordinated networks. So these are led by a public department or a foundation that both funds and convenes the centers. So New York and Nevada are examples of this. And then we have nonprofit coordinated networks. So this is where a nonprofit entity coordinates the network, providing backbone support with dedicated staffing. So the nonprofit entity itself is not the network. And the nonprofit may incubate the network to spin off in the future, or they may continue to coordinate it. So Alaska, North Carolina, and the state of Washington are examples of this nonprofit model. And then the last one we'll talk about is an independent network. So this is a staffed independent nonprofit organization that functions as a membership alliance, and the members pay dues. So these networks, they may raise and they may distribute funds as well, where they function as an intermediary, or they may not. So Colorado and Maryland are examples of this. So those are the different types of network. The next thing we'll talk about are the stages. And this is the developmental journey that these networks are on, just how far along they are in this journey. And it's not a linear journey, just like anything else in life, but here you can see the general stages. So starting with emerging. So this is in that birth to 3 years of the network, when they're just getting started, determining who's going to be at the table, what they want to focus on. And then the next stage is evolving. This is typically in that 3 to 5 year mark. So as the network is further developing, they may hire a contractor, maybe hire their first staff. The network is beginning to have more structure and capacity to do more. And then when a network is considered established, they're typically in that 5 year or more mark. And this is when networks are typically having staffing and a track record of activities. One interesting characteristic of these networks is that they have weathered crises and they have decided to stick together. All right, so that's some of the foundation we wanted to lay prior to introducing the Texas Network, which I know is why we're all here today. Very excited to introduce to you our presenters for today from the Texas Family Support Network. And to kick us off, Chelsea is going to be hopping on to introduce the network. So excited that you're all here today. Thank you so much for being here.
Awesome. Thank you, Julie. Definitely excited to be here, especially with the team here in Texas. It goes without saying, but I'm going to say it anyway. Texas is very large, so we got a lot to talk about, and excited about where the network is going. Along with me, we have Chief Prevention and Community Wellbeing Officer, Sasha Roscoe. She's going to be joining us. We have David Bryant. He's our Special Projects Manager with Prevention and Early Intervention. Both Sasha and David are with Prevention and Early Intervention. And then I am joined by Tamika Caldwell. She is also with the Texas Center for Child and Family Studies and is the Family Support Project Coordinator for the Texas Family Support Network. And I myself, of course, am Chelsea Alexander. I'm the Family Support Network Coordinator with the Texas Center. So we are excited to be here. And y'all are going to hear from all of us today clearly. So we'll be jumping around a little bit, but hopefully it will all kind of make sense and come together as we start talking about it. So the Texas Family Support Network was founded a few years back. And one of the things that we believe the network is about, and really what it was founded on, before I get into the mission and vision, really at the heart of the Texas Family Support Network is collaboration. And that's why we work so closely with prevention and early intervention with Sasha and David and their team. We just really believe that when we come together to support families, that's really what's going to create changes and waves in Texas. So you can see our mission there is to promote positive outcomes for all children and families by leveraging that collective impact of communities. And when we're talking about collective impact of communities, what we're really talking about are those family resource centers. Those are communities, and we believe that family resource centers are their community and can have a huge impact wherever they are and wherever they're located. And so we want to make sure that we are doing our part to work with them and support them. And then our vision is just to ensure that families are thriving across communities and that they have their own village of support right there located within the FRC. And so that's just a little bit about the Texas Family Support Network, just a little smidget. I'm actually going to pass it off to Sasha, who's going to kind of give us a rundown of the history and how the network got started. And then we'll just move forward from there. All right, Sasha, take it away.
Good afternoon, everyone. I sort of feel like the old granny and the rocker about to tell you a story about the good old days, but even that's not been that long ago. But just a little bit of background about the role of the biggest public funder. The Prevention and Early Intervention Division is housed in Texas's Child Welfare Agency. We are a separate arm that separated from Child Protective Services, but we have a variety of funding streams, including our community-based child abuse prevention grant for those of you who, at the state policy level that know these different programs. We also have the MCV, Maternal Infant Early Childhood Home Visiting program, and then a lot of legacy state-funded parenting and youth programs, as well as programs that were relatively new when we were launching. So what was happening back in or the kind of the years leading up to 2017, which you'll see on the next slide, was when we started kicking off our involvement with the National Family Support Network. We were 2 years into merging with the federally funded home visiting program and launching a lot of state-funded work. And doing all the things I think that everybody was doing at that time, learning more about evidence-based programming, how to do things with model fidelity, track outcomes, work upstream from child abuse and neglect. And a lot of that involved, I think, two things that led us to NFSN. One was, how do you attract families voluntarily? How do you find them? How do you understand what services they need if you're not coming from a downstream or reactive system like child protection, but really just trying to catch families earlier when they need help? So we were really, we were in the midst of working with all of our community partners in a variety of ways of kind of connecting to parents. And then we also were putting kind of bringing up-to-date old programs and creating new ones. And so the standards for us became this very helpful tool that had, that already put together elements that we were putting in a variety of different grant opportunities about what a quality family organization looked like and needed to embrace. So for us, it was like, oh my gosh, this is what we've been, having all kinds of meetings inside of Texas to figure out. And they've already done all the work in the quality standards framework. And at family resource centers were an answer to, how do you position services for families in a way that meets their needs, where they need them, when they need them, and doesn't feel like child protection or some other scarier system. So we became interested. We were still, obviously a public funder and a state agency. So the first thing we did on the next slide is we just decided with one of our legacy programs, which is called the Family and Youth Success Program. And I will say at the time, it was not called that. It was called the Services to At-Risk Youth. And it was partly our work with NFSN and kind of getting to know that we worked on renaming this program, including Parent and Youth Voice, to call it the Family and Youth Success Program, as opposed to Services to At-Risk Youth, which, I don't think we need to say any more about why no one liked that name. So we took that program, it was legacy. It didn't have the structure we had in a lot of these evidence-based home visiting programs we were rolling out. And so we thought this is a place where we could really use the quality standards. And we wanted to start with them and training them on the quality standards and sort of see what happened from that conversation. So PEI did that. And then by doing that, we were the network at the time. We were the state network within the Department of Family and Protective Services. You can see a map of our phase, our network of phase community-based providers. And then springing from that, thank you for the intuitive slide progression there. We then created, like I said, the network out of the state office of the Department of Family and Protective Services, and the collective groups that became certified, our phase providers who sort of joined up. And it quickly, on the next slide, you could see that we quickly realized as a state agency, we were only going to be able to do so much. When we received our CBCAP, ARPA, or COVID money for CBCAP, that we were already poised and ready then because of the work we had done to springboard 7 family resource centers. And we have since then, this is where we started. And I know you're going to hear, first of all, I can say you're going to find out why we launched from being a public network into having a partner through the Texas Alliance of Child and Family Services and having them house this network. They're going to show you why, because they're amazing. And David's going to tell you a lot more, but this was our launching space. We've since then taken a lot of our state's preschool development grant money and also funded even more family resource centers. We got another almost $40 million per year from our state legislature in this last session. And as you can imagine, family resource centers, we expect to continue growing with some of that expansion funding. But this was our starting place. And it was at this point, I think, that we started to feel like someone else could do even more with this work than we could. And we then, I think that is when we had already been working with the Texas Alliance, who had expressed an interest in, they're a member organization. Their members were expressing interest and excitement about opening family resource centers. Private funders were starting to get really excited. We cannot receive private funding. So that was one other, I think, puzzle piece. We needed an entity that could work more directly with those private funders. We could definitely be thought partners, but we could not receive funding. And so that was the decision we made, was to shift our work and move from launching the very beginnings of the network over to our partner, the Texas Alliance of Child and Family Services. And I think does that conclude my good old days story hour? I think so. Yes, there you go. So I think I get to turn it back over to Chelsea to tell you how they took it from there.
Yeah, we're actually going to pass it off to David. He's going to kind of talk a little bit more about kind of that shift and how he's been working in partnership with our team to make sure these family resource centers are supported, and we are working together to make sure that they have everything they need to support families within their community. So David, I'll let you take it from here.
Thank you, Chelsea, and thank you, Sasha. One of the things that Chelsea mentioned as we first began was the collaboration, the collaborative approach, and that's something that we love to have. Is just working together to make sure that all families are being strengthened and families are being reached here within Texas. And so when we look at the timeline, Sasha kind of laid out very eloquently how we progressed through our timeline. And so going, as you see on the screen, May 2017, kind of building that was kind of our year. Just kind of coming together with NFSN, and then 2018 standards grant phase grantees have that funding opportunity to kind of get that more structure into the ground, as she already laid out. Let's jump down to September 2021 when we added our FRCs, our 7 FRCs that you just saw the map about. And as we transition to now kind of July 2022, we rolled out an opportunity for all of our phase program just to make sure that I had the NFSN standards woven throughout the program, not just the first pilot ones, but to make sure that across the board, as Sasha mentioned, our legacy, our family and youth success programs all were connected to NFSN standards. Um, and then as you see now, it's September 2023, where we're at now. As Sasha mentioned, we had funding come through to where we moved from our first 7 FRCs across Texas. Now we're at a whopping 17, which is great. We're moving, we're more than doubled, right? And so because as what was said earlier, family resource centers are great kept secret, but they're very instrumental in families across the state and across the nation. As we move on to the next slide, I want to kind of lay out for you just a couple of things. One is just 4 things as we share, supporting family resources. And so how do we do that here at PEI? Just as I was introduced earlier, as I slow down a little bit, I'm David Bryan, the Special Projects Manager. And part of my role is to help oversee, help to work with our FRCs and help to kind of connect with the center and Chelsea and Tamika and her team. So one way we help support family resource centers is through funding. As mentioned, we have 17 FRCs through a couple of different funding streams. Sasha said earlier, which is our community-based, our CBCAP, our community-based dollars, community-based child abuse prevention funds. Well, within the last few months, we were able to add 10 more FRCs to that with our PDG funding that we received this spring. And so that this enabled us to add more of our Texas Home Visiting, our THV grants to the program, and also our HOPES programs that we have across the state of Texas. And so part of the funding that we have or that we're able to do is kind of also that quality assurance, but also letting families, letting programs and community-based providers know that we're here with you, right? You're the boots on the ground. We're here to make sure that whatever we can do, we want to make help enable you to do the work with families. The second thing you see on this slide is program specialist. And so with each of our programming, PEI assigns a program specialist to the community organization's primary grant. This program specialist also works to support the grantee and their FRC work. And so we want to make sure that we have different layers of support, supporting the grantee as we're working with NFSN standards, as we're working with the center, they're providing the TA support. That's another level that we support family resource centers, is assigning them a program specialist for their program. The third thing you see is the subject matter expert. I wouldn't consider myself an expert. I'm learning. I'm doing as much as I can to learn, watching as many videos and site visits and reading. But that's my role, is help to support our family resources across the state, all 17. And so one way I do that is by attending the peer collaborative meetings that we have together. And so one of the things that the center helps do, because as you saw, that they're now the lead for our Texas Family Support Network. And so we hold collaborative meetings. They hold collaborative meetings with our FRCs, just making sure, hey, what's going on? And of course, you're going to hear a little bit more about that later through Tamika, but just sharing what's going on. What are some things that we're seeing? What are some trends that we're seeing, right? I'm on those calls just to make sure they know that PEI is here. We're here with them. We're hearing, we're listening, and we want to make sure that we are equipping them with what they need to be successful. Also, we're available to answer questions as far as my role as well, just being able to be a support for each FRC. I also serve as just partnering with our program specialists. And so it's making sure that the program specialists have what they need, that are supporting our FRCs, asking questions, doing certain things to, again, just to make sure they have the support they feel that's needed from their funder, so to speak. And then finally, again, just those checks and balances, making sure that we're hearing the needs. One of the things that we learned was around data entry. We have our own reporting system that we have. And so one of the questions that through the center's work that came up to the surface for us was just finding out, how do we record? How do we enter? What is considered an enrollment, right? What is that? And so when we enroll a family, are we enrolling just to meet the numbers? Do we enroll everyone that comes through the door? We heard that, and through the center's peer collaborative calls, or TA, with our FRCs, we heard that, and that was related back to us. So we came up with, hey, okay, let's make a guideline. When do we enroll a family? And so we were able to do that as well. And then finally, as you see, the last bullet is working with the center. the center, the support that they provide to our family resource centers has been amazing. And so the center has frequent technical assistance calls with our grantees. We go on site visits together. So as you can see on the screen is a picture of one of our site visits that we attended up in one of our family resource centers. They were having a 1-year anniversary celebration. Yay! And so we went out there with them to celebrate with them, to see their community partners, just to see some of their families, to meet their staff, just to be there. And so that was another level as we celebrate that milestone with them, just for myself to be there from PEI, but also to be there with the center, saying both sides are supporting you. We're giving you all the support you need. We are behind you. We're not just saying that, but we're here with our support and being in person. And so it's been a great working relationship working with the center. And so we are glad that they're helping to lead our network. As we look at the next slide, talking about the technical support, like what is needed, the technical support from the center helps us to do quite a few things. One thing, it helps us to measure success. As we're looking at our outcomes, the families that we're serving, the needs of the community. As you know, each family resource center is different, right? If you're a family resource center, each community is different. So what are the needs? What are the goals? What are the outcomes that the family resource center has established, right? We're also measuring success around what's working, and even working with the center. What are the best practices in the FRC world? What is in your professional role? What can we bring back to Texas, right? So the center is out there just kind of collaborating. They're talking. They're a part of the NFSN network. They're meeting. They're doing various things. So then we can hear on PEI side and help incorporate in some of the things that we're sharing with the grantees, in addition to what the center is sharing with the grantees. You know, it helps when we're all speaking the same language, right? It helps when the center is saying one thing and who's leading our network, and then we as a funder helping to support are saying the same thing. And that's one of the things that's really cool about the NFSN standards, is that shared language. And that's something we help to shift. And so we're shifting from program talk to FRC talk. That's another thing the center has helped us to do, because a lot of our grantees and community collaborators are organizations. They're wonderful, they're great, and we appreciate the work they do on the ground. And so a lot of the organizations are familiar working with programs and doing certain things. Well, an FRC is not a program. It's a community hub of support, as you heard in the introduction from Julie. And so just making sure that transition as the center is sharing that in their TA that they have, as we're sharing that from a funder, just kind of say the same thing. It comes across that they understand it and they get it. Also, the center has helped our grantees to kind of shift from just, again, program talk to talking the standards, talking NFSN, making sure that's clear in the reports, our quarterly reports that we ask them to do, our annual reports that we ask our FRCs to do. That language is enfolded in their reporting, and it's great. Finally, we want to talk about just a team approach, right? And so, again, we're here together as a team. We're working together as a team, involving our program specialists, involving our parent support professional that we have on staff. PEI, we have a parent lived experience, right? And that's something that we've implemented within our programs as well, as that lived experience. So we're having our parent support specialists share with our FRCs. And we're coming together, working on as a team with our self-assessments, right? And with our implementation plan, and just making sure that we're all on the same page. And then finally, we want to make sure that we're building a firm and solid foundation. One of the things that we did was, when we first funded our first 7 FRCs, is we have now considered that our cohort 1, right? And so some of that was developing the best practices that we're learning. You know, one of the slides that came up that Julie mentioned was like the emerging, evolving, right? We're still in that kind of those first stages. And so we're learning, we've learned it, and we haven't got it all together, but what we have learned now with our second cohort, as we mentioned, we just added 10 more family resource centers to our state through PEI funding. What we've learned in the first cohort, now we're able to implement and have that same consistency across the second cohort. And that is something that the center is helping to implement, as we're taking them to, as we're kind of networking, as we're having the meet and greets and so forth, and coming together just to make sure that we bring the new cohort with the more seasoned veterans that have been in it for a while, to leverage experience, to talk, to say, what were your successes? What were some of your downfalls, right? Does things look like in your community? And even to encourage those field trips to your FRC. Well, how are you doing things over there? Let's come visit your FRC, which is 8 hours away in the same state. Yes, folks, we are in Texas, so it takes sometimes 8 hours to get from one side of the state to the other. But encouraging that collaboration so we can have that same foundation that FRCs are experiencing. And so we love working with the center. They have been great, and growth is happening. And so, and they're helping to do that for us. So with that said, ladies and gentlemen, I want to pass the microphone over to our great colleague, Tamika Caldwell. She's going to share some of the more in-depth work that the center is doing with our family resource centers here in Texas.
Thank you so much, David. And thank you to PEI, Sasha and her team. The center, we're just really appreciative for the opportunity to be invited to be on this journey, this FRC journey, to be invited to steward the future of the Texas Family Support Network. And so a huge thank you to you all for entrusting us with this work and collaborating in this work. You know, one thing I'd like to say before I move on is PEI is set an example for what the standards can really do when funders adapt and are committed to implementing the standards. You heard David talk about a parent support specialist, having someone with lived experience to steward the work with their parent advisory committee. That's standards work, that's implementation work. Ensuring that programs that they're funding have a foundation of the standards and what they are and how to implement them. So they are leading by example in that. And so as they partnered with the Center for Child and Family Studies, my name is Tamika Caldwell. I am the Family Support Project Coordinator with the Texas Family Support Network. I want to share this slide here has, it's pretty much a flow chart that we kind of created to help explain all of the entities that are involved in this work. So the Center for Child and Family Studies it's a 501, C3 nonprofit supporting organization of the Texas Alliance of Child and Family Services. And so that's what you see on the top left. And our mission is working really collectively to support and strengthen children, youth, and families and communities across Texas. And that looks a number of different ways. As Sasha mentioned earlier, the Alliance is a member organization. And so we work with a number of organizations statewide to support the work. And our vision is just that a vibrant, strong, and unified community of leading child, youth, and family serving providers across Texas. And again, we do that in a number of ways. And so you see that we're connected to the Department of Family and Protective Services, the PEI division of that. And PEI's already explained that they've funded some funded FRCs. And this was where I came into the work, was really at the very beginning in 2021, when they initially funded those 5 FRCs and then 2 more in that first year. And so I'm gonna move to the next slide, and we're gonna kind of go a little bit deeper with the work that we've actually done. You have another timeline. It's very similar to the one that David shared, so I'm not going to go over this in detail, but it really just shows the growth and the development over a number of years of implementation of the standards in supporting family strengthening and support programs. Julie, if you go ahead and advance to the next slide. Thank you. So on this slide is really the center's role in all of this work. Training, I'll start with that. The foundational mandatory required training for the family resource centers that we're supporting through the network is that they have the foundation of the standards. As you heard David explain, PEI speaks the standards language. The center staff have been trained and are trainers in the standards and speak the language. And we want to ensure that as we're talking about family resource center work, that each of the family resource centers that we're supporting also speak the standards language. And that, in essence, has really guided our collective relationship with PEI. It's guided the growth and development of FRC work. And it's also it's also brought some other interests to the work, and particularly in the standards being foundational elements of future work. And so that training, the standards are offered, and Chelsea will talk a little bit more about that from a networks lens, but we do offer that standards training to all of the staff that are working in the scope of the Family Resource Center. And it's really interesting. Some of the programs that we're working with, organizations, let me rephrase that. Some of the organizations that we're working with that have other family support programming, they've invited some of their other staff to be trained into the standards as well. And so it's really been awesome to see how that has grown across organizations that are providing support to children and families statewide. The technical assistance piece is I meet regularly with each of the Family Resource Center teams that looks a different way depending on the need. And so this technical support in the first year was monthly. We met monthly, talked about the different things, and this continues to, we're in year 3 now, this continues, but really this is about the individualized support of the FRC team. And then another thing that we do is, David mentioned the peer collaborative meeting, and that's really designed to bring all of the FRC teams. So one of the things that PEI required is that a representative, at least one representative of each FRC attends that peer collaborative meeting. And in that meeting, we've set it up to where the FRC teams can, there's peer collaboration and peer sharing. So they're learning and sharing together in these spaces. At times we've brought in professional development opportunities in that space as well. But really, in particularly that first year, this was new to everyone. FRC work was new. And so the how to and the what to was really unknown at that time. And so we really saw in that first year, as people were, began to get in their groove, that they wanted to share with each other. Hey, this is what we're doing. Another person would go, wow, that's a great idea. Let's try this. So that also brought that collective impact piece. And that's the third bullet, developing and sustaining collective impact success. As you know, FRCs are not, there's not a whole lot of funding and support for FRCs, which is another reason why we're so appreciative to PEI for stewarding this work, for starting it and stewarding it from their space, and being a funder, an awesome funder and partner with us in this. And what we're really hoping to do is that it continues to grow. Now, one of the things that we acknowledge is that, as you've heard multiple times, Texas is huge. We know that there are FRCs that existed before 2021 when PEI funded the first 7 FRCs. And so what our hope is as a network is to continue to learn about those other FRCs while also stewarding the work of the FRCs through that are receiving funding through PEI. And hopefully, one of our goals is to maybe get some additional funding outside of PEI to support future FRCs. All right, we go to the next slide, please. So these are just some of our key partners in this work. Of course, you see the PEI is our main partner, and they've provided the funding for it, but also the support around that. The National Family Support Network, they have been instrumental in connecting us to other state networks of FRCs, and those connections have really informed us over the last 2+ years in this work as well. There are some networks that have been doing this for a very, very, very long time. And so as we were, I like to say in 2021, we were re-evolving, re-emerging, excuse me, we were re-emerging as a network, and now we would fall in that evolving category. And so it's been really nice to connect with other state networks and learn about the FRC work that they're doing and how they're supporting their FRCs. At the top right, you see Ascend Aspen Institute. And those of you that are familiar with that, they are the ones that founded the two generation approach. And that's all about building family well-being by intentionally working with both children and the adults in their lives together. And so we see that all the time in the FRCs. We're not just working with parents. There might be different caregivers, kinship providers, and others that are providing support and care to the children. And so the Family Resource Centers work with the whole family collectively. Another partner in that with us is the Hope National Resource Center. And in our first year of FRC, providing support to the FRCs, there's a lot of work and a lot of research and a lot of support around ACEs, adverse childhood experiences. And as I was doing TA support with the FRCs, the different FRC teams, one of the components of an FRC is that it's strength-based. And so we partnered with the Hope National Resource Center to receive some training on positive childhood experiences. And there's now a lot of research around positive childhood experiences and how they can mitigate the effects of ACEs. And so we can provide training now with their support to the FRCs around their 4 building blocks that promote positive childhood experiences. And those building blocks are relationships, environment, engagement, and emotional growth. And so that's all about helping children to grow into healthy and resilient adults. And so we're really grateful for that partnership with the Hope National Resource Team. iLead Consulting is another partner. For those of you that are not familiar, iLead is a consulting firm here in Texas, and we've partnered with them in other work. And so we invited them to the table to provide some training to our FRC leadership, or to provide them with leadership development. And so as a result of that, they, this was, I believe, last year, they partnered with us and provided at no cost the Leadership Challenge training, which is a 2-day training, to the executive leader of the FRC and also to the manager or coordinator of the FRC. So the person that is there and present, boots on the ground every day. And so we provided them with an opportunity to go through that training together as a cohort. What we took from that is there was a connection that happened on a leadership level with the FRCs. And as a result, some of them started visiting and continued to connect with one another around their FRC leadership. Parent Nation is another partner of ours, and they provide, Parent Nation is actually a book that was written, and it is an initiative as well. It's a national initiative, but they developed what's called a Parent Village Toolkit and curriculum, and it's available for free. And that is all geared towards bringing those small groups of parents together to support and equip and inspire, and most importantly, advocate for a society that better supports parents and caregivers so that all children can thrive. And so Dr. Suscan and her team provided some training to our FRCs around the parent villages and how to implement that in the FRC sites. So those are just, and the last one is that, and they're certainly not the least one, I left them last because Chelsea is actually going to talk about them and their work, and that's the St. David's Foundation. And so I'm going to save that to build a little suspense and allow Chelsea to talk about that one here in a little bit. Next slide, please. So, and Julie can go ahead into the next slide. So we now have the center now has technical assistance. We're receiving technical assistance for our support and our work with PEI and with the family resource centers that they fund. And so we're really, really excited about this opportunity. This initiative just started in June of this year. But the Harvard Government Performance Lab supports government in building effective service systems to deliver better outcomes for people, for children and families. And so they have a program called the Child and Family Wellbeing Accelerator Program. And this is an initiative that helps basically jurisdictions across the nation to design and execute successful initiatives that strengthen child and family well-being. Well, from some of the TA support that we provided to the FRCs, there was a theme that came up. And one of them was, you know, how are communities, how are individuals in the community hearing about the FRC? Are the people that are accessing the FRCs, are there more people that are not accessing the FRCs that we're missing? And so they're helping us answer some of these questions. Linda and Emma are the two individuals on the GPL team that are meeting with us. And when I say us, they're meeting with the center team, Chelsea, myself, and David from PEI. And we're working together to support the family resource centers and you know, and better outcomes. And so what we lean from their support is we applied and we're granted to participate in this program. And it's basically 10 months of technical assistance for us and for the FRCs that we're supporting. And so the next slide, we'll go a little bit deeper into the work that we're doing. So we're in the initial stages. Again, we just started this in June, July. And so, well, actually July is when we have the kickoff. And so we're really focusing on connecting priority populations to FRCs. So again, there are some families, and those of you that are familiar or work in FRCs probably have experienced this, where there are families that just come. Like a family tells someone, they tell another person, and they just come. And what we really want to make sure is that we're also meeting the needs of families who may not voluntarily come to FRCs. How can we connect with them? How can we ensure that they're getting the support that they need as well? And so there are a few, you know, preliminary questions that we're hoping to answer through these next 10 months of work with the GPL team. One is, how do we connect families beyond those who proactively seek out support? How do we do that? We want to get to families and prevent them from ever having to be involved in child welfare. We want to provide that family strengthening and support to them. But how are we getting the people that we need to get? Are we reaching the people that we need to reach? So we're hoping to answer that question. Another question, which families are getting served? So who are the FRCs currently serving? What demographics and populations and groups of people are they currently serving? Another question that we're asking is, are we reaching those most in need of support? We know that sometimes families that need the support may not reach out. And so we're asking that question as well. Are we reaching those most in need? And then lastly, when families are served, do they have better outcomes? We want to know that. Are we being effective? Are the FRCs doing what they are designed to do? And so the image that you're seeing now on the screen really is a timeline of our work. We're in that July to September, that first phase. And in this first phase, the GPL team has done a few things. One, they've met with every FRC in the first cohort, so the first 7 FRCs. They've met with each of them virtually and their teams, and really talked and learned more about their FRC, the communities, and more importantly, the resource navigation component of the FRC work. Additionally, they came and did a visit to Texas. So they visited us towards I believe it's the end of June of this year. And they met with the center, and David also joined us in this work in that initial meeting. And we really started planning and looking at what are we really hoping to gain from our time together. We then took a little tour. So they visited 2 of the FRCs that we're supporting. So they had a chance to take a tour, to talk to the staff and the teams, actually see how the FRCs operate day to day. And that gave them a better understanding of the FRCs that we're supporting. They'll be visiting a couple of more in the next month or so as well. And so we're really excited about that. they also enjoyed coming to Texas, so we enjoyed hosting them as well. And so in these first few months, that our goal is really looking at the onboarding and diagnosing of what's already happening with the FRCs. Another way that PEI has been really huge in this space is providing the data, sharing the data of what we're seeing so far with the FRC work and the families that are being supported through the FRCs. And so through that data, through other data that we have access to publicly, they are beginning to identify, we're beginning to identify as a collective team, some themes of populations, of priority populations. We're also looking to define what does priority population actually mean? And that may be different from FRC to FRC. And so you see in the second tier of our work from September to March, we'll be designing and testing whatever we decide from the first tier. And then the last one will be scaling and sustaining and looking at that in the last March through April timeframe of our work. So we're just so excited about the opportunity to participate in this program. The next slide will share a little bit more about our initial stages of work with the GPL team. So you can see in the diagnostics, so this is really tier 1 from the last slide. We've got to have feedback and buy-in from not only the center and our team, but we needed buy-in from the PEI team. They immediately said, yes, let's figure out how to do this. And then lastly, again, if you're looking through the lens of the standards language, we couldn't do the work that without having the FRC leadership and frontline staff in this process with us. And so that's where some of those individualized meetings have come from, and there will be additional opportunities that come in the future. And you see the questions that we're looking to answer through our time and our work with the GPL team. And that right arrow on the right side, you see it says background and baseline referral data. And so bringing the feedback from the FRCs and the entities that are involved, staff that are involved in the work, and then looking at the data together, we hope that we'll be able to answer some of these questions in the middle. And so to be continued, we look forward to sharing some of what we learned from our support and the technical assistance support from the Harvard GPL team. And so we'll put a plug in that and say to be continued. All right, next slide. So, I mean, a picture's worth 1,000 words. One of the things that I learned personally in supporting the FRCs is for about the first full year, I worked with them virtually. Of course, they're all over the state geographically. The distance it varies from FRC to FRC. And one of the most impactful moments for me was when I actually visited each of the FRCs. I read about them in their reports. We talked, we met virtually. We had Zoom meetings for our peer collaborators and all of that. But it wasn't until I actually saw the FRCs in person that I felt equipped to really better understand the work, their communities, and also just seeing what the FRC looks like. So these next 2 slides are just images of the actual FRCs that we're supporting. And they also speak to some of the relationships that are developed with in their communities. And you can also see, if you're looking through a standards lens, you will also see some of the sections of the standards implementation in these images as well. And with that being said, I think there's one more slide. Yep, there's one more slide. These are, again, all 7 of the initial, the first cohort of FRCs are represented in each of these 3 slides. So we're really excited about the future and the continued growth of the work. And with that being said, I am going to pass the mic to Chelsea.
So resource centers and the work. These last couple of years have just been so incredible to not just work where we are locally, but get to know the family resource centers that are a part of the Texas Family Support Network. So I just want to kind of close us out with talking a little bit more about just overall, when you're looking at high level, what all we are doing as the network, and share an experience that we've been able to have over the last year. There's some opportunities for engagement with the PEI FRCs that are within the network. Obviously, Tamika and David have alluded to that technical assistance and training pieces. The other thing that Tamika may have highlighted, I believe she did, was that right now the network consists of prevention and early intervention family resource centers. But as mentioned before, we are an alliance, and we have a membership organization, and that's kind of overarching us. And so with that being said, we have a lot of touch points with the child welfare system. And so we recognize and understand how important and how vital family resource centers are to communities. And so what we're finding is that there's a lot of interest in wanting to know more about what family resource centers are from our members at the Texas Alliance, and not just them, but folks that are within Texas that have caught wind of family resource centers, and they really want to know more about what they are. So Tamika and myself schedule and coordinate those meetings, and really the goal is to educate them on what family resource centers are and what they are not. And bring even more awareness to them. We have to say that a lot of times, actually every meeting we have with folks that are interested in learning more about family resource centers, we direct straight to the National Family Support Network, because there's just so much there. But I think we feel also, as the representatives of the Texas Family Support Network, is that be it individuals, organizations, funders, whoever that might be, that's showing interest, that we really explain to them the value of the standards of quality, and incorporating that family voice, that families are at the center and they are at the heart of a family resource center. And so we are very mindful of how important that messaging is. And so anytime we're having those outside meetings, we want to make sure that people know that, and we want to be sure that we support them in their efforts if they are to go forward and launch a family resource center. So you can see, while we are working really closely with PEI and their team for the family resource centers that they have been able to fund, it is still two of us, Tamika and myself. And so what we're really excited about in the future is being able to incorporate those family resource centers that are not PEI funded. And so we're still evolving, as we have alluded to here. And so we're excited about that. And of course, they have all talked about the collaboration that happens across family resource centers that are within the network. That is a huge piece, eye-opening piece for not just ourselves when we go visit the family resource centers in Texas. I mean, y'all saw how big that map was, and David even said it's an 8-hour drive, maybe from one side to the other. But there's so much value in each other learning from one another. And so as the network, we want to make sure, as we continue to add in new family resource centers, that everybody has opportunities to learn from one another and to work with one another. And we really try and be mindful and keep the lens of the standards of quality as we are developing and implementing the network. And Tamika talked about community partnerships. And one that she was alluding to was the St. David's Foundation. As the network, we work with multiple folks. Clearly, our partnership with prevention and early intervention is huge. Tamika alluded to iLead, but really we want to make sure that we are bringing different types of resource and support to the family resource centers within the network. And so also sometimes that can look like a funder. And so that is one thing that I'm kind of going to talk about here. You can go ahead to the next slide. It's been a great partnership that we've had the privilege of talking with. I'm sorry, I skipped a slide. I skipped one. Hang on. Let me just revert back to the standards of quality real quick, because I think there's something important here I want to highlight. If y'all can tell already, we love the standards. We have drank the Kool-Aid. But I did want to mention this. We do offer the standards training monthly to all PEI grantees. So what that means is you do not just have to be a Family Resource Center staff or individual as part of the Parent Advisory Committee, anyone that is a PEI grantee is able to participate in the standards of quality training that we offer monthly. Sometimes we do more than one a month. It just depends on what all is happening. But we try to make sure that that is offered because we strongly believe in the impact that it can have, not just with family resource centers, but if there's not a family resource center identified where that organization is located, at least we are starting somewhere with the standards of quality. And so we're really excited to be able to do that. We have 14 standards trainers across the state, and that is absolutely necessary because it's just so important that we have different faces in different places, right? And so we want to make sure that we have standards trainers that are capable and are doing this work and living this work through their roles and what they're doing. And that sounds like a lot, which also means for us within the next coming year, we will probably be incorporating more than one a month. Because I think at the end of this month as well, we'll be adding another trainer to our network of trainers. And just to make sure that we're keeping track of things and holding one another accountable as we meet quarterly, the trainers do, just to talk through any news from NFSN, anything that's happening in trainings that we're seeing. We want to make sure that we are giving the training and doing the training really well. And so we're really excited to continue to offer that to PEI grantees, as well as their community partners, anyone that they're working with closely at their FRC, or if they're an organization that is a PEI grantee, if they have community partners, we also allow those folks to join the standards of quality training as well too. So that is a huge piece to the Texas Family Support Network. So as always, credit to NFSN for just such an awesome development of a tool for us to utilize. All right, we can go ahead to the next slide. I jumped ahead a minute ago. So we talked about our community partnerships, and we really wanted to spend a few minutes just highlighting our work together with St. David's Foundation. St. David's is a private funder, and they've done a lot of work supporting lots of organizations within the child welfare system. And so we are super fortunate to be able to have a relationship with them. And a couple of years ago, the Texas Center was approached about just some work about learning more about family resource centers. And so they were kind of new and learning about what it was. And they really wanted to just go ahead and fund some family resource centers locally in Central Texas, because that's where their funding base is. And so I wish the funder was able to join us today. They wanted to, but they couldn't. But one of the things that, and they'll tell you this story, is that they actually went to fund and to put out applications and were prepared to write a check. And then they started researching about family resource centers. They looked into the National Family Support Network and they paused. And while some of you are like, wait a second, Chelsea, like, why would they pause? Like, that's not a great thing. It was an amazing thing. And a lot of times I think what we need more of, and that's, they said, we need to hear from more community leaders in Central Texas before we just do all of these things. We want to hear what would be most beneficial in launching family resource centers here in Central Texas. And so what they worked with us to do, we put together an advisory committee of about 15 individuals. You can see everybody pictured here in these two photos. And so what they said was, hey, over the course of a year, let's get together a couple of times, ask questions about what family resource centers are, what could happen in Central Texas, what could this look like if St. David's were to fund family resource centers, how do we incorporate family voice, how do we make sure that families are accessing the FRCs, all of these questions that you ask when you're thinking about launching a family resource center. And so as a group, we came together, we called them gatherings. And what St. David's did was they not only just said, hey, let's meet and talk about this, but they said, let's go tour a couple of family resource centers outside of Texas. And so they funded the trip for everybody you see in these photos to travel to Colorado. And so we got to meet with the FRCA there, and we just learned so much. We got to tour 3 family resource centers, Focus Point, Sister Carmen, and Morgan County Family Resource Center. And they were just like, we were all like sponges, just soaking up all the knowledge that they had. We also got to go to Colorado and visit with Ventura First Five Ventura County, I'm sorry. And that was just incredible. And you can see in that photo there on the left, or on my left, I'm not sure if it's y'all's left, there's a young woman with her daughter. She was a parent leader, and she came and talked to us, and it was like the highlight of the entire trip. And so we got to experience all of that together. And all of our advisory committee members were also given an honoraria for their participation over the course of the last year. And so what we're doing is working to put together a report of just some of the questions that we had initially, or that really St. David's had at the jump, and putting all that information together and utilizing our experiences, our lenses from going on the tours. And what I loved most about this advisory committee was these weren't just folks that were professionals in this space. They are community leaders, they're parents, they are authors, they're mental health professionals, and they've been doing a lot of work in this area already. And so just super excited about the opportunity to be able to do that with them. And what's come from that really is that St. David is really interested in learning more about funding the network to build more support in, so that as FRCs are launched, we can continue to provide the things that will be most beneficial for them. So I have a quick video. Julie, I'm not sure if we have time. I think we might be able to show it pretty quickly, and then wrap up, and then we'll have some time for questions.
It might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness.
So that was just a snippet of our tour together, and it was just so incredible. And really, as we're thinking about the future, not that we set out to do this, but we just recognize the value of the advisory committee. And so as we're thinking about the future, and Texas being so large, we're trying to figure out how to create that small town, right? And so one of the things that we feel like there's an opportunity to do to bridge that largeness is to maybe potentially form advisory committees within different regions of Texas, and them be the ones that are informing the FRCs. Maybe they're already where FRCs are already located, they be the launch pad for forming that advisory committee, or a parent advisory committee or caregiver committee, something that helps inform as more FRCs launch and are established and become a part of the network. We just saw how much value their voices brought to the table. We're also excited to be hosting our first Family Resource Center Summit next year in the spring. And that is definitely in partnership with Prevention and Early Intervention, who is just like, we're with y'all, whatever y'all want to do to make sure that family resource centers have support. So we're excited to be able to invite folks to attend that. Like we mentioned, definitely the non-funded PEI FRCs, we're really excited about opportunities to work more with those folks, and even folks that have been doing this work long before we came along. We call those the legacy FRCs. And of course, continuing the technical assistance and trainings, and then that collaboration piece. All of it, like I said, and how I started, the heart of the network is really about collaboration and how can we make sure we are all working together, not for anybody, but working with one another so that we can make sure that families have exactly what they need and can thrive right there in their own communities. So with that, I'm going to pass it back to Julie. And I think there might be some questions we might need to answer.
Yes. Thanks so much, Chelsea, and to Sasha, Tamika, and David as well. Such wonderful information. Want to invite everyone to, if you haven't already, to put your questions into the Q&A portion of the Zoom panel. Just want to give you an opportunity to do that. We have some questions that have come in, and a couple we've had a chance to answer individually, but we'll answer those live as well, just so everyone can have the opportunity to hear and learn from this in this incredible space. So while you are contemplating the questions you're going to put in, just want to share some resources and events that are available to you through the National Network. So the Webinar Wednesday series, you're familiar with since you're here today, but just want to flag that this is something we get to do on an ongoing basis. And these are free and open to everyone. And the next one we have coming up that's live will be in just a few weeks about developing family resource center networks. Where do we start? So that one is coming up in October. In addition to the ones we offer live, there is an incredible vault of recorded webinars that you can access related to family resource centers, family resource center networks, and the standards of quality, both program and systems level implementation, and advancing the field as a whole. So encourage you to check out the Webinar Wednesday page on the NFSN website. I know the Texas Network has shared how pivotal the standards have been in their developmental journey. If you're interested in checking them out, it is a 2-day certification training. You can see here we have this is our schedule for what we have space in currently. They do fill up fast. We've actually had to add some additional certifications this month. So these are open to everyone. You also can check there's a map on the website to see if your state offers the certification training like how Texas does. So you can access the training either through one of the open trainings or in your state. So check out that page for more information. And there's also, talk today too, just about the value of having the stakeholders that you're serving at the table to inform decisions. So this training is particularly for developing and sustaining effective parent advisory committees. And so the tools and everything that are needed to do that. So it's co-trained by a NFSN team member as well as an experienced national parent leader. So you can see here at the dates coming up for that. Just a couple of other resources to flag for you as well. There's the Family Resource Center page on the NFSN website. So tons of information on there. Family Resource Center overviews, there's videos, virtual Family Resource Center tours, just research reports, systems level funding information, just all sorts of information. And then there's other resources as well. Want to highlight particularly the member network snapshot. So you got to hear a bunch about Texas today. And if you're interested in learning about other networks across the National Family Support Network, 39 other networks, you can take a peek at these snapshots on the website to learn a little bit about each of them. And we also have 2 hubs that are available, and both are free and for everyone. So the first is the Family Resource Center Learning Hub. This is a compilation of resources for those that are developing individual family resource centers. So rather than reinventing the wheel, there's templates and samples of different types of documents that are common in family resource centers. And the FRC Learning Hub was developed with the support of Casey Family Programs. And the other hub is the FRC Network Hub. So this is a compilation of both NFSN templates and documents from member networks that can be used as examples for FRC networks and funders. So if you're working at the systems level, like the Texas folks that presented today, that may be a valuable resource for you as well. And again, these are free and available to everyone. Some services available to you through the National Family Support Network, just facilitating connections to other member networks. We heard today just the value in learning from each other. So if you're ever interested or curious who may be a good fit for you to be connected to, just feel free to reach out to the NFSN team. We also can present for key stakeholders. So education leaders, child welfare leaders, children's trust funds, public-private founders, many others as well, all about working with and investing in family resource centers. We also are available to provide technical assistance for family resource center network development. And we can provide trainings. Of course, you heard about our open trainings, but we can provide those for your particular groups within your state as well. So the standards and the developing and sustaining effective parent advisory committee training. And with that, let's go back to the Q&A. So that's our information. I'll pop this up here just for the sake of the recording, so you know how to get a hold of the NFSN team. But you can access the staff page on the NFSN website as well. All right. We have saved the best for last here with all of the questions, and want to just cover a couple of these were answered in the Q&A, but just want to make sure that everyone has access to the answers here. So there was a question about the grant review process. So what is the grant review process to receive FRC funding in Texas?
I guess I can take that one. So far, it's been us putting out grant opportunities. To be clear, we haven't made a grant opportunity available specifically for FRCs to the broad Texas community. What we have done is as we have received like additional federal dollars, we have turned to our existing community of grantees who are providing either home visiting services to families with very young children, or crisis counseling, or parent education, or youth counseling, which are sort of the more our legacy set of services. We have said to those 160 community organizations, which are made up of nonprofits or school districts or counties or cities, we have said, would you take on additional money, or you have an opportunity to take on additional money to open a family resource center? Yes or no, and then give us an opportunity, kind of give us a proposal of what it would cost and how you would do it. And then we funded them as we have money and as the proposals have been, strong and viable. And so we've done that with a few different flavors of funding, I think, as David went through. The latest being our preschool development grant, which is part of a larger state investment in creating a healthy pipeline for our young kiddos to be ready for school. And so the grant funding has been sort of contained within our current providers. The exception to that is we now have, I mentioned, 40 million additional state dollars to distribute in brand new communities and brand new programs. And so this is the first time we have put out funding for broader competition or for new folks to kind of get into it, but still not specific to family resource centers. We tend to fund things sort of in a more umbrella way, where we're saying, hey, community, we would like for you to provide services to this particular population. We usually have like 0 to 5, or more broadly families, or we have some special population groups like fathers or military families. And then we say, here's a variety of ways in which you can a variety of community solutions or services or programs or infrastructure. You can build you can do collective impact, you can, and family resource centers are one of those options we provide, but we haven't done something that is just for family resource centers. So we've been funding it as a part of a menu of options in a variety of like staggered ways. And I know there a few people were asking for, kind of what does our RFA look like so they could sort of see it themselves. And again, we don't have one specific for RFAs, but I'm going to find something more recent where we can kind of pull out the language where we talk about family resource centers specifically, because certainly we understand building a request for, we call them RFAs, sorry, request for applications, not which are more for grants than RFPs, which are requests for proposals, are more for contracts. Sometimes I understand the difference, sometimes I don't, but I know, but just bureaucratic lingo being what it is, I thought I'd spell out the acronym. That's a long-winded answer to that question, in that it's like lots of different ways.
Yeah, that's very helpful. And there's also, just to give another plug for the FRC Network Hub, there's sample RFPs, RFAs in there as well. So just to mention that those are in there. And there's another question about how you manage data collection for the FRC.
So I think this is someplace where we share some responsibility. So I'll answer about what the state does, and then Chelsea or Tamika can answer what they're doing from the network perspective. We do collect data. We have an automation system that our grantees can provide directly. Like, we're not doing like fill out a data or a survey or anything. We have one of the benefits of being in a big state like Texas is that you have some economy of scale to have infrastructure to build automation systems like this. So everybody who's receiving funding from us, whether it's for a family resource center or for some other type of parent or family support, does enter data. And the granular level of that data depends on the intensity of the program. So whether they enter client data and fill out and do protective factor surveys, and how much outcome data we follow up afterwards, and how much we get a sense of their experiences with family resource centers, because they can be so light touch. I think we're collecting some very basic data. And not, we're not able to follow up every client in the long run, like, because they may just come in one time and that's fine. So it's not as intensive as the data collection we are collecting on some of our more intensive services. But so that's kind of I don't know how much I answered that question, but we have some data, and then I don't know, Tamika and Chelsea, what you guys are collecting.
Can't see the screens here, so I'm just gonna assume here. If you recall, thanks, Sasha. That's super helpful. If you recall, y'all remember the slide where Julie said emerging, evolving, and established. This is where we're in the evolving phase and working to determine what data is the most important to gather. And so, clearly we work pretty closely with PEI, and so we rely some on their data and what they are tracking, but it's something that we're working towards figuring out what is important, what we need to track, and how we need to track it, and lots of nuances there. But what I can say is it's on the forefront of our mind. And right now, some of the data that we generally collect is through the FRCs. If we are seeking information from them on our support, so that might be through surveys and through different trainings that we might provide them outside of the standards of quality. So we're really in the beginning phases of that and still trying to work through that and figure out what data collection looks like for us. Tamika, would you add anything to that?
No, I think you covered it. I think that's the other benefit of being a member of the National Family Support Network is we've been able to connect with other networks, other state networks who have some more established data collection tools and processes. And so we're being very intentional about what that looks like for Texas, one, because of the size and because of the diversity of the FRCs that we're supporting. And that is pretty much our top priority at this point, is identifying what does that look like for our network? What data do we need to collect, and how can we collect that with the support of the data that PEI is already providing and collecting.
David, do you have anything to add? David's really, he knows all the things on our side. I don't know why I'm doing all the talking.
No, you're doing a great job. I think I would just say we do collect also like the numbers, the outputs is what we call them. The family resources share. How many families are you going to serve, right? And so we do track that along with that, you know. And one of it is like we want to serve a big number. Realistically, what does that really look like? So kind of scaling back, but that's something we do also in serving. Like it's like enrolling families versus how many families are showing up to a parent cafe or to an outreach event. We track those events as well. But those are the only kind of other things that we also track internally.
Great. Thank you so much. We have time for one more question. And there was a question in here about, you know, just the differences between the FRCs based in counties and just with the different, with the different initiatives and how you're connecting the FRCs that are not currently part of the network. And so I was curious if you could talk briefly about your survey process that you went through, because I know other networks have used a survey to get a sense of the lay of the land. So would you mind sharing a bit about what that looked like?
Thanks, Julie. So, gosh, I guess it's been 2 years now when we first kind of started as the center getting involved in this work more intentionally. One of the things we wanted to do outside of the PEI funded FRCs is find out what information was out there, who was out there, what they were doing. And so we are fortunate to have an evaluation team as part of the Texas Alliance of Child and Family Services. And let me be clear, when I say team, it's one person, so I'm not going to get crazy here. And so she helped us put together a survey that was sent out to lots of Texas Alliance members and asked to be sent if there were any FRCs that we were unaware of. And so we were just collecting data on what they were doing as an FRC. Did they call themselves an FRC? Were they familiar with the standards of quality? And asking those questions on the front end to just get some information and utilizing that for us to see what would be beneficial as the network. And so what came from that really is the recognition, one, that we were going to need more than Tamika and I to really help support some of these FRCs. But one of the things that we did do was those that were interested, we had a virtual meeting to have them all get together, share information, talk about the Texas Family Support Network. And I will say, not just through that survey, but again, as family resource centers have been being lifted and highlighted over the last year and a half here, as well as what's happening within the child welfare system, and folks have just become more interested. And so we've been able to, all those folks that we've had meetings with that are interested in FRCs, we were able to have a meeting with all of them together. And so they were able to meet and talk. And again, that was virtual, so let's not get ahead of ourselves. But, you know, I think that's something that we are wanting to do in the future as well. And so that survey was really helpful in generating that and getting some of that traction going. And then we really do check in, even though we're not at this point adding more FRCs to the network that aren't PEI funded. We do keep in contact with them. We check in, see how they're doing, and just see if there's anything that we can provide briefly that would be helpful to them in serving their own communities as well.
Thanks so much, Chelsea. And we are out of time, so thank you everyone for your wonderful questions. And if you have questions that you still have, please feel free to email a NFSN team member and we would be happy to either answer them or connect you to the Texas folks here that can answer your questions. So thank you again so much to Sasha and David and Tamika and Chelsea for being here and presenting on the wonderful work that you're doing. Thank you to all of our participants for being here today and for joining us for this webinar. As a reminder, a brief evaluation will appear on your screen when you exit the webinar today. We greatly appreciate your feedback on this evaluation, and it very much helps inform future webinars and helps us to develop what content would be most helpful to you. So thank you again for being here, and we hope you have a wonderful rest of your Wednesday.